Good morning, and thank you for having us. Good morning, Steve.
Good morning.
So it's been a fascinating discussion. We've heard a lot about the theme of health equity. Share with us how you see health equity and how you think it has been redefined and shifted over the past decade, and why.
Oh, sure. So it has been an interesting journey on this topic, and somewhat I'd say I'm somewhat frustrated by the lack of progress in it. I don't know if anybody is with me on that, but I started my career in healthcare about 30 years ago with a public health background, working in inner city Detroit, early 90s, late 80s, launching managed Medicaid into the inner city setting, and got to see the need and the issues, very, very close up. And I would say now, fast forward 30 years, it's sitting here in 2018, the issues have actually intensified, in my view, and the need has grown. And there's a lot of reasons for that. From our perspective, from UnitedHealthcare, we have this kind of unique view across the healthcare continuum. But first of all, there's a lot of macro demographic trends that obviously are adding stress to the system. Aging population, more chronic diseases, and then we have this incredible dynamic in our economy where we're spending almost 20% of our economy on healthcare, but the way we spend it is backwards. 80–90% of our health issues come and are caused by issues that are outside the traditional healthcare system that you've just heard talk about, social determinants of health and other things, yet only 20% of our spending goes towards those things. So that equation is wrong, and that continues to be set in motion unless we do something very dramatically to change that. So I think that is a factor. And then you think about the social determinants of health, and I know a lot of people in this room live with these statistics every day and are very well versed in it, but these kind of blow me away. This idea of 40% of the food produced in the U.S. is wasted, but there's 41 million Americans that live in a home where there's food instability, where almost half the babies born in the U.S. are going to be born into a Medicaid family, which means they're going to be born into a family that's earning less than the poverty level, which creates health inequities just by definition. And so this idea that we have a healthy economy and low unemployment, it hasn't seemed to help this, and so it's gone from a peripheral kind of an issue to absolutely central to changing healthcare in this country. So it's only intensified.
It's interesting. I know you very well, and I've heard you talk a lot about redefining access to healthcare. And I think for a moment, if you could share with us, how do you define that? What do we need to do to redefine what access looks like?
Sure. So I think this is a really important conversation, and it's not just semantics. It starts with a way of thinking about health and healthcare, and we're traditionally called, or people call us, a payer of healthcare, and I actually spend most of my time thinking about how to actually redefine healthcare and to Administrator Verma's point, pay for it differently to create different kinds of behavior and more of a system. But the idea that this idea of 80% of our health is affected by things that happen outside of the doctor's office and the hospital, yet we don't traditionally think of those services as healthcare. And so it starts with a redefining in our own heads that food stability, education, housing, transportation, more of the mental health sort of capabilities in our country need to be brought into the mainstream of the healthcare system. That requires a different way of thinking. It requires a different investment. It requires more attention to strengthen these really important components. And again, I think we used to think of them sort of peripherally, and now they need to be a central part of our healthcare system. So redefining that is as much of a activity as it is a mindset, and I think that'll be really important for us to do.
You know, as someone who's been in the industry for 30 years, you've seen a tremendous evolution. And yet I know that the statistics you shared earlier are the things that keep you up at night.
Yeah.
So this opportunity to redefine access and this opportunity to bring all of those clearly global health issues to the front and center to help us think about the go-forward strategy. Talk to me about that. You know, what does that mean to you when it keeps you up at night? How do you define what success looks like?
Sure. We believe, and I personally believe, and our organization believes that we can make a difference. So I'm optimistic. I'm hopeful. I really appreciate the conversation and the attention to this issue. And so, you know, for example, this idea of thinking about the components that aren't traditionally part of the healthcare system, we have started to invest in those deliberately and to try to bring them into the mainstream. And we don't do it just for UnitedHealthcare members. We've actually set a goal to redefine and create better access to health for 1 million additional people every year outside of UnitedHealthcare. And that's going to be through strengthening these community partners that exist in the community today that are just kind of hanging on and just barely making it, but adding such incredible services, whether we're talking about, you know, food banks or community health centers or federally qualified health centers. The list goes on, but there's a lot of folks out there who are struggling and really trying to do this, but don't have the right kind of resources, infrastructure, and funding. And so we're trying to bring some of that and strengthen partnerships because, you know, it really is the case in this situation that, and this one of our favorite phrases, 1 + 1 + 1 can equal a lot more than 3. And in this case, it's really true that we have an opportunity through partnerships to really do something extraordinary because none of us can do it by ourselves, even though we have you know, I lead a very large healthcare organization, but we can't do this by ourselves, and we need all kinds of partnerships. And again, I think our mission is to help people live healthier lives and to help the health system work better for everyone. And so to live that mission, we are getting after this, and we're going to stick with it. And I really appreciate the opportunity to be here, be part of this, and to participate in the conversation.
When you think about that mission and so core to your DNA and how you can change the trajectory of the access, just as you said, 1 + 1 + 1 is far greater than 3, and it takes bringing unlikely partners to the table to really do that effectively. As you go about tackling that and talking to folks within the community and leaders within healthcare, you know, take us forward. You know, what do you see the opportunity being? Is it addressing those 28 million uninsured individuals? Is it addressing those who have access and thinking about prevention earlier?
I think it's all those things, but I think this idea, and we heard Administrator Verma talk about it, heard the panel talk about it, and this idea of until we start thinking about healthcare relative to the whole person's experience and their environment around them, then we're not going to fix this thing. And so organizations like ours, organizations that you all represent in the room, we have got to kind of come together in a way, and I'm fond of this phrase too, which is blur the lines. We cannot be so hung up on the traditional boundaries that we have found ourselves in. And so payer, hospital, community center, all these lines need to get blurred so we can create more of a system around the whole person. And I really do also believe in the idea of moving from kind of a volume-based approach to value and outcome-based approach. And we have all the tools now. We have the technology, we have the data. And so this is going to happen. This transformation is going to happen, and we're all part of it. And so, you know, it's time to, again, come out of the wilderness into the mainstream and be part of the central healthcare system. And it's a very exciting time, and I think the transformation is real.
Well, thank you so much, Steve. We're excited about it, and thank you for sharing your vision and your mission and what UnitedHealthcare intends to do about it.
Thank you. Appreciate it.